If you experience a persistent, janky tightness in your lower back every time you try to stand up straight, you aren't alone. This diagnostic checklist identifies that specific sensation as extension sensitivity. If leaning backward or standing tall triggers your pain, the root cause is rarely where it hurts. For years, the fitness industry has placed the blame for this type of dysfunction almost entirely on the psoas muscle. However, as we see here, there is a hidden driver operating entirely under the radar, the iliacus. While the psoas on the left is highly respected, it's the iliacus on the right, housed inside the pelvic bowl, that is often driving that lower back tension. This anatomical distinction is why traditional lower back stretches or psoas releases often fail to provide lasting relief. The tension is originating from a place those methods simply cannot reach. This biomechanical map shows the physical reality. While the psoas originates on the spine, the iliacus is anchored entirely within the basin of the pelvic bowl. When the iliacus becomes chronically tight, it creates a mechanical breakdown, pulling the entire pelvic bowl forward and down. This forward tilt forces the body to compensate, creating a localized, painful compression that radiates directly into the lower spine. To resolve this, we use the iliacus release protocol. This targeted approach requires only a floor and a simple stacked peanut massage tool. Because the muscle is sheltered by the pelvis, relieving that spinal compression requires internal, localized pressure to interrupt the cycle of tension. To begin, lie face down on the floor and prepare to position your stacked peanut. Accuracy is vital. The target zone is strictly inside the front crest of the hip bone. You must ensure the tool is not resting on your ribs or your lumbar spine. The stacked peanut is shaped perfectly to the internal basin of the pelvis, allowing it to sink into the red highlighted zone shown here. Once you've found the spot, do not push down into the floor. Instead, allow your entire body weight to completely relax over the tool. Since the iliacus is tucked deep within a bony structure, this passive stacked pressure is the only way to physically access and affect the tissue. Now that you're in position, take a moment to get comfortable as we prepare for the active phase of the protocol. We call this the rotational wiper. Keeping your leg relatively straight, slowly rotate your foot in a wide arc, both internally and externally. This motion uses your leg bone to strum the soft iliacus tissue back and forth across the static pressure of the peanut. You will likely feel significant discomfort, but it's important not to rush the movement or tense your core in response. This cross-frictional strumming, when combined with that precise placement, is what finally breaks down the restrictions driving your back pain. As you continue those rotational sweeps, focus on taking deep, rhythmic breaths. This signals to your nervous system that the pressure is safe. For the release to take effect, you must sustain this action for a minimum of 2 to 3 minutes per side. You'll know you're succeeding when that initial sharp pressure slowly begins to dull as the tissue finally starts to yield. You cannot force the iliacus to let go. It requires this dedicated time under pressure to neurologically signal the muscle to release. When you stand up, you should feel an immediate difference, less compression in the spine and a much freer hip when you lean backward. There's a strict rule: never deploy this protocol before a heavy workout. Deep tissue work desensitizes the area, making it dangerous to load your spine with heavy weights. Instead, optimal times are in the evening, after heavy pulling, or following a long run. Resolving long-term mechanical dysfunction requires treating the hidden origins of tension during your recovery windows, rather than just chasing the site of the pain.